Sometimes the biggest challenges in medicine have these really surprising connections. We tend to think of heart problems and, well, nutrition as two totally separate fields. But today we're going to dive into how, for the most fragile little patients out there, these two things are absolutely critically connected.
Just think about this for a second. For a tiny baby born with a heart defect, the simple, natural act of eating can become an exhausting life-or-death struggle. It begs a really important question. Why? Why on earth does a problem with the heart turn feeding into such an incredible battle?
Well, to get to that why, we first have to really understand the what. We've got to define the massive challenge these tiny patients are up against every single day. So at the very center of all this is something called congenital heart disease, or CHD. Now, all that really means is that a baby is born with a heart that has some kind of structural issue. It could be a hole where there shouldn't be one, or maybe some of the big arteries are just wired up incorrectly from the start.
And here's where the link just becomes staggering. Get this, depending on how serious the heart problem is, anywhere from 15 to a whopping 64% of these kids also struggle with malnutrition. This isn't some rare side effect, it's a massive central part of the whole condition.
And what's so tricky, so insidious about this, is that most of these babies are born at a perfectly healthy weight, so the problem isn't obvious right out of the gate. The trouble, the failure to grow, it starts to creep in during those first critical months of life.
So why does this happen? Well, you have to imagine that for these infants, their body is fighting a constant uphill battle. Every single breath they take, every beat of their heart, it's like they're running a marathon 24/7.
And this is the fundamental problem, this crazy paradox. On one hand, their little bodies are in overdrive, what doctors call a hypermetabolic state. They're burning through calories like crazy just to keep their inefficient heart and lungs going. But, and this is the cruel twist, on the other hand, all that effort makes them too tired to eat. Plus, their bodies often can't even properly absorb the few nutrients they do get. It's this vicious cycle, way more energy going out and way less energy coming in.
Let's take a common example, like a hole between the heart's chambers. With every single pump, some of that blood goes the wrong way. So what does the heart have to do? It has to work overtime, pumping that same blood again and again. And that just burns an enormous amount of extra energy.
And then you've got even more complex conditions like tetralogia fallot, which is actually 4 different heart defects all rolled into one. As you can imagine, this just multiplies the workload on the heart, sending the body's energy needs completely through the roof.
It's really a perfect storm. The problem is coming from every direction. The heart and lungs are working harder, which burns more energy. The body isn't absorbing nutrients properly. And to top it all off, doctors might even have to restrict fluids to manage heart failure, which makes it even harder to get enough calories in.
Okay, so with such a complicated mess going on, how do doctors even know when a baby is starting to fall behind? Well, it turns out they have a really precise way of decoding the body's growth signals.
This isn't guesswork, not at all. The medical teams have a whole toolkit of measurements. They track weight and length, of course, but they also look at things you might not expect, like how long does it take for the baby to finish a bottle? If that time starts getting longer and longer, that's a huge red flag for fatigue. It's all about using data to catch these problems as early as possible.
So what are those big alarms that tell the team it's time to intervene? Well, if a baby doesn't gain any weight at all over 2 weeks, or if they're having major trouble feeding, that's a clear signal that a more aggressive plan is needed, and fast.
And that leads us to the most hopeful part of this whole story, the solutions. How do medical teams craft a nutritional lifeline for these kids? What's the actual game plan to help them grow? Now, this is so important to get. This isn't just about feeding a baby. This is medical nutrition therapy. The goals are super specific. They want to spark catch-up growth, meet energy needs that can be up to 50% higher than a healthy baby's, and, this is the big one, get the child strong enough to handle life-saving surgery.
And the approach they take is really smart. It's systematic and it escalates as needed. They start with the simplest thing, make the formula more calorie-dense. That way every single sip delivers more punch. If that's not enough, they can use a tiny feeding tube so the baby gets all the nutrition they need without any of the exhausting effort. And in the most critical cases, they can bypass the digestive system completely and deliver nutrients right into the bloodstream. And that brings us to what might be the single most vital takeaway from all of this. You can't fix a heart if the body isn't strong enough to handle the repair. For so many of these children, getting their nutrition right isn't just about helping them grow. It is literally their ticket to getting the surgery that will save their life. So it's pretty clear, right? For these kids, nutrition isn't just food, it's medicine, every bit as powerful as any drug on the pharmacy shelf. It really makes you wonder, what other incredible hidden connections between our diet and our health are we only just beginning to understand?